Well, I went into the Air Force in 1966. I stayed 20 years, 2 months, and 7 days and retired.
Enlisted in the United States Navy in 1966. Graduated from submarine school that same year, served for 4 years, was honorably discharged in 1970.
Was in 3 years during the Vietnam War.
I was in the Army, a medic, and I was stationed in Korea for a while.
Volunteered for the Navy in 1942. Was assigned to Fleet Radio School.
I spent 3 years in the Army. About 1.5 years I was in Korea during the war.
Well, it was over almost 3 years ago. I was at the VA with my regular VA doctor, and I told him I was going downhill fast. My body was just giving out. I was gaining weight, wasn't doing much of anything. He said, "I've got a program. I'll see if I can get you into it." And about 6 months later, I started Gerofit. I've been with Gerofit over 2 years now, and it's changed my life.
These are my 8-month-old twins. I had bilateral knee replacement in September of last year due to arthritic conditions, which have significantly improved in my knees since then, but mainly because of probably the program here.
I was pretty active. I played City League ball until I was about 50, and when I started falling down, running to the bases and swinging and losing my balance, I figured it was time to quit. That was before I had my stroke. I was in the hospital about 3 months. I was doing therapy in the hospital, and for a little while I wasn't doing anything, so I told my doctor next time I saw him, I said, "I feel like I need some exercise." They said, "Well, we know a program that you might be interested in." The rest is history. I came and I started bringing myself, and I seemed to get better and better and better.
27 years ago, I had bypass surgery. Since then, I had congestive heart failure. I have a defibrillator in my chest for now. Well, 3 years ago, I had to have 2 stents put in. About 15 years ago, doctors told me only 10% of my heart was alive.
2 heart attacks.
2 heart attacks, yes.
I've been somewhat vertically challenged all my life. If I was 8'2", my ideal body weight would be this. However, I'm 5'6". No, the reality is, over many years of working on your feet on concrete floors day in and day out, it just wears on the joints. I had to have knee replacement. I knew the physician had told me a year ahead of time, so I joined Gerofit to prepare for it. I lost 42 pounds before the surgery and increased my exercise tolerance significantly. He now calls me his poster child for bilateral replacements because I was literally up and walking 2 days after the surgery. Not unheard of, but certainly unusual. And I do credit the program for that. I've been in it for almost 2 years now. I continue to lose weight, only at a slower pace, but the exercises are a significant impact on my overall health.
I had a sciatic nerve problem from my right hip all the way down to my foot, right foot. Critical pain all the time, very critical.